So my name is Buki Usidame, and I'm an assistant professor with the Department of Public Health at Purdue University. So certainly there are several benefits of quitting smoking. So smoking is the primary cause of lung cancer. So first things first, someone who quits smoking within 15 years reduces their risk of lung cancer by 50% or more compared to someone who kept on smoking. Then also other lung-related problems. So we're talking of coughing, the wheezing, respiratory symptoms, shortness of breath. Within 1 to 9 months of quitting smoking, people see increased improvement in their lung functions. And that translates to your stamina, translates to just the use of your respiratory system. Then cardiovascular issues also. So smoking is a major risk factor for cardiovascular diseases. So within 1 year of quitting smoking, you reduce your risk of coronary artery disease, you reduce your risk of heart disease. So those are cardiovascular effects. We also have benefits when it comes to your oral health, because smoking is a major risk factor also for oral cancer. So when you stop smoking or you quit smoking, you reduce that risk of oral cancer, of even things like tooth loss, gum disease, just visits to the doctor. Then we also know that smoking, that smoke especially, affects like your car, your home. So those are also places that you you see improvements in when it comes to health benefits. You also reduce the risk of people living with you being exposed to secondhand exposure, secondhand smoke. So there's several health benefits: improved life expectancy, increased stamina. I could go on and on, but those are just a few of the benefits of quitting smoking. So because of the health benefits, several of those translate to financial benefits. So if you have lower risk of lung cancer or lung-related problems, you're going to have fewer healthcare costs. So visits to the doctors, smoking-related diseases, even to the dentist. So you're going to have lower dental care costs. But let's look at a practical example. So if on the average, you spend about $7 a day to buy cigarettes and you quit smoking, in a year, you're going to save maybe almost $3,000. That's huge. That could pay off some credit card debts. That could help you get into some kind of hobby that improves your quality of life. So you get financial benefits from savings mostly. So from healthcare costs, we know that people who smoke have to pay higher insurance premiums. So you save on that also. So this is all places that smoking takes money, and then you can save on all this and translate them into something to improve your quality of life as an individual. So first things first, in the United States, we have what we call the 1-800-QUIT-line. So if you're thinking about quitting, you call that phone number and you're connected to counselors who will help you to create what we call a quit plan, to walk through it. Then we also do have lots of online resources. We have the smokefree.gov. We do have our healthcare providers who are able to provide prescriptions, medications for people who would like to quit smoking. We also have what we call the behavioral therapy and counseling, which is an effective mechanism that has been used to help people to get out from that addiction. We do have apps. We do have text messages. We have like the Smoke-Free TXT, that engage people that are trying to quit smoking. We have local support groups, so peer groups like family and friends and people who are experiencing similar issues, and help each other to come out of it. So there's several resources. But I'd like to say that quitting smoking can be very challenging. So it's not something you do once and you're like, oh, I couldn't do it, and you give up. Many people who quit smoking did it after repeated tries, because it's hard, but it is very possible. So if you're looking to quit smoking, start and don't stop, and you will successfully be able to quit smoking. So the Great American Smokeout is more like an annual tradition. It's like an annual event organized by the American Cancer Society to remind people about the dangers of smoking, the benefits of quitting smoking, and the resources that are available to you if you want to quit smoking. So it started out as an event in 1977, but since then it's become something that happens nationally and annually. So it's like an awareness, attention event to everyone that's smoking. Like, look, this is what this is doing to you. This is how it can help you. And when we help you, these are the benefits that you see. So it's just a call to action for people who smoke to see what can be done to help them quit smoking.